Former First Lady Dr. Bongi Ngema-Zuma has led a 5-kilometer walk to raise awareness about the pervasive impact diabetes has in many communities. She, as you've seen, is with us here in studio this afternoon to talk more about her work in this space. A very good afternoon to you, and thank you for coming in. Diabetes will be the leading killer by 2040. It is the second killer at the moment after TB. Why is it that all of these campaigns, all of these talks are not bringing it down?
Because they are not enough. We are not doing enough yet. We need more advocates for diabetes. The government is trying, but we need to put it more, give it more priority. So we have to talk more regularly about diabetes as we talk about cancer, as we talk about other communicable diseases as well, like TB. Everyone knows about TB. But diabetes, you don't find many platforms where people get to be educated about diabetes. But also, once a person has been diagnosed, there is no one that sits with them and explain why it is important for them to comply to their medication. So they don't know the repercussions of not taking your medication, for instance. And also, people are still struggling with even understanding what the disease is and what it means to them once they are told that they are diabetic.
Why is it then, doctor, that it is not getting the due attention? Because these latest figures aren't anything new. Over the last, 10 years or so, we've been hearing that diabetes continues to claim more lives. A 2016 report says 15,000 women alone died because of diabetes in this country. Yet, as you're saying, people aren't being told about just why they need to take their medicines as per the directives of the doctors. Why aren't health professionals filling that space?
I think there is lack of awareness generally all over the world, because we say all over the world 1 in 2 people that are living with diabetes do not know about the disease or that they have the condition. Also, the level of awareness in Africa as a continent, 70% of people do not even know what diabetes is all about. And also the fact that when you get diabetes, you don't feel any pain. So people don't take it seriously. And yet it has so many complications that come with it, where then it mushrooms as like a heart disease or kidney failure, or, then you are starting to see the symptoms which are complications of diabetes. But diabetes itself does not make you feel any pain. So this is why people tend to just ignore it, but lack of awareness and lack of education.
Is diabetes awareness then suffering because of the more popular diseases, your TB, your HIV, your cancer? Is that why we're seeing the situation?
Certainly, I would say all chronic diseases suffered when the HIV and AIDS took us, by that storm, and it became a pandemic. And all the attention was channeled towards HIV and AIDS, such that when you are advocating for other diseases, let me talk about diabetes, for instance, you even struggle to get companies that want to partner with you, that want to fund you to do the work that you want to do, because it's at the back of their minds. The one thing that they think about is HIV and AIDS.
Let's talk about the work. And I want to speak about what you are doing specifically in this field. You've been at it for years. You've just had this walk recently. What exactly do you do on a daily to turn the tide?
Well, we have our vision, let me start there, as the foundation, is to see a South Africa where diabetes ceases to be a killer due to lack of awareness. But we have a multi-pronged approach to our audiences. Our primary target being people in rural areas, in peri-urban areas, townships, where information scarcely reach in our own languages. So we have interpreted and did pamphlets in maybe about 8 languages now. We have Tsonga, we have Zulu, we have Xhosa, and all these languages, so that people understand it in the way that they can read it. Because most of the information about diabetes is extracted from overseas countries, American Diabetes Association. But on a daily basis, we send information. If you go to our website, you'll get a lot of content about diabetes and even other things that can help you, like nutrition, how it interrelate with TB. We've done a lot in sending out information in all platforms. But then, like yesterday, we had our World Diabetes Day commemoration, which was the 9th one since we started. So 9 years in succession, we've been reaching out to all corners of South Africa with a message where we now physically screen people. We
live to make sure that they can maybe avoid or reduce their chances of getting diabetes, because it is a lifestyle disease.
It's reaching out to them. First, a person must screen and hashtag know your number. Know where you stand so that we can tell you if you are here, you are at high risk of developing diabetes. And these are the interventions: exercise, eating healthy, and always regularly screen. When you go to the doctor for something else, if you have said you are on high risk, check that you are not, or that you are not proceeding to type 2 diabetes. Remember, type 2 diabetes affects 90% of the 425 million people that live with diabetes, and 80% of causes of type 2 diabetes are highly preventable. So people have to know what the signs and symptoms are. People have to know how to then manage diabetes and live healthily. And this year's theme is the family and diabetes, because it doesn't discriminate. We found yesterday a children of 3 years whose readings were shocking. Mm-hmm. The mother was in denial at first time, and then we sent the child to drink water, come back again still. So that child has been referred. So we are seeing these things happening every day, and more education has to be given to people in the languages they understand. And also when you talk about nutrition, help them to say, you can plant your little garden at your home. So while you're tilting your garden, you are also exercising, because we're saying exercise and nutrition can help manage diabetes and other chronic diseases.
So the overriding message then being that we can turn the tide. Dr. Ngema, thank you so much for your time.